Michael Burgess, Republican of Louisville, returns to Washington this week with health care on his mind. You're going to be questioning Health and Human Services Secretary Kathleen Sebelius. That should be a lot of fun because you're a physician. Yeah, that's this Wednesday, and that'll be the second time in a couple of weeks that she's come before our committee. And, you know, with all the trouble that we've seen now with the rollout of healthcare.gov and the website, yeah, they ask the question, the website will be fixed at some point, but what's next? I got to say some of the darkest days are probably ahead of us because the part of the website that wasn't built was the part that handles provider payments. So insurance companies, doctors, hospitals, nurses are all going to begin to suffer from the fact that no payments might arrive after January 1st. I will just tell you from perspective of having run a small practice for a number of years, you can last about 3 weeks if there's an interruption in your accounts receivable.
If I'm a patient, the other side of it is, from the patient's viewpoint, is I may have gone through this thing and thought that I have signed up for XYZ health care plan, and I'm going to find out on January 1st when I, God forbid, have to go to the doctor and plop down my insurance card, they're going to say, we don't have any record of you.
I don't know if that will happen. There may not be any record, but I'm sure the go ahead and treat, go ahead and do whatever is necessary. But then the question of who gets paid later on, and you'll have some fights between insurance companies, doctors, hospitals. I mean, those go on all the time anyway. But it's going to be, it's likely to be much more serious than it's ever been before.
There are a lot of people who feel that no matter which side of the issue you're on this, that Republicans want to see this system fail, because that will give you political ammunition for the midterm elections.
I actually disagree with that. And what we're seeing, the problems we're seeing right now are because the healthcare.gov was not ready. And yet you have 5 to 10 million people who are on individual insurance plans who are now losing. That type of loss is really painful right now, and a lot of people are going through it. I don't want to see that extended to another 80 million people next fall, but that's exactly what might happen. One of the things that I will be questioning the Secretary about is what are the contingency plans? I've asked her this before, but what are the contingency plans that you have to deal with things if they don't work as intended? Because over the last 2 months, what have we seen? Nothing has worked as intended.
Right, and quickly, we're just about out of time, but quickly, there are some indications that what the federal government's going to do is what the federal government does so well, just close its eyes and write a check. If the doctor files a claim, no verification until sometime after the fact.
Correct, but they may then come back to the doctor and say, that was inappropriate, you shouldn't have received that. This patient, in fact, didn't have insurance. You did the service, but we're not going to cover it.
Yeah.
And unfortunately, after the fact, those retrospective reductions may happen.
All right, thanks so much. Sir. We appreciate it.
Good news, yeah.
Good luck heading back there to where reality is just optional.
Thank you.
Appreciate you coming by.